I'm Stephanie Shelton, and this is Conversations on Health, How We Get There, episode 31. Have you ever been hit by a huge medical bill when you thought your health insurance would be covering most of it? Do you know that unpaid medical bills are one of the main reasons people declare personal bankruptcy in America? Well, meet Frank Lobb. He's a retired Navy pilot whose later managerial background in law and compliance had absolutely nothing to do with healthcare. But some years ago, Lobb had a very frustrating and ultimately very tragic fight with his wife's insurance company. And he began researching health insurers, personal medical bills, and your rights under the law. He's now written 4 books on what he's learned. The latest, just recently published, is called The Big Lie in My Healthcare Bill. Here's our conversation, and I think you'll learn a lot from Frank Lobb about how you can protect yourself and your family. I certainly did. Frank, thank you so much for coming on the podcast. This should be really interesting.
My pleasure.
So, I've never heard anyone say how much they love their health insurer. And you particularly, you've written 3 books, and this isn't even where you started out in terms of your profession. How did you get into health insurance when you basically worked in environmental science, so you were a pilot, nothing to do with health insurance?
No, it really wasn't. But part of my life got involved down in Washington on the Clean Air Act, and I was known as a pretty, I guess, central player in negotiating the Clean Air Act, which had me nose to nose with some of the best attorneys in the country. So I have a background in law, but I'm not an attorney, and it's just another part of my life that's been very, very diverse. But what happened to me was I had a wife that was very ill. She was literally pulled back from death's doorstep, and they needed additional care. The doctor prescribed it, and my insurance company said they wouldn't pay for it, and the hospital told me they wouldn't provide it. And I said, forget the insurance company, I'll pay for it. And I was told I couldn't. And I went nuts. I had never been told that anybody in the United States could keep you from paying for your own health insurance or health care, which was crazy. And to make a long story short, she died. And I took our insurance company into court, and I was in court against them for 8 years. Now, I'm not an attorney, but I sure couldn't afford to pay one either. So I was the attorney for 8 years against a very, very major insurance company. And they will tell you that I lost. I'm going to tell you I won, because what I got access to were all their internal documents through the discovery process. So I can tell you what insurance really is and what it isn't. And I defy anybody else to tell you that, because no matter who you talk to, unless it's somebody on the inner side of a big insurance company, they haven't read the contracts. And I have. And I have experience in my long world of doing contracts for companies like DuPont. And so I knew what I was reading, and I knew what I was being told that was absolutely false. And I'm just trying to share that with the American public, because it's probably the biggest con that we have going in the country. In other words, everything we think we know about it, health insurance, is dead flat wrong. And it's all to the insurance company's benefit.
I tend to think most of us don't think we know anything. We don't bother to know anything. If you get insurance through work, sometimes you have no choice. Most of the time you have no choice. This is what you're handed. And then you can go to one level or another level, but this is the company you're going to work with. If you're using Obamacare or something like that, then you have choice, but the process is so difficult. I think you probably just find whatever you can find and grab it. And there are very many limitations, which maybe you know as well as I do through Medicare, in terms of your backup insurance, your secondary insurance. So I venture to guess that until something happens, like it happened to you, most people are just throwing up their hands and saying, I'm going to live with it. Can you explain then, from your experience and your knowledge, what the relationships really are. I think most of us don't understand who pays whom, how do we get indemnified against having to pay, or what do we have to pay? How does it work exactly?
Well, when I say everything we think we know about health insurance, I'm willing to agree with you very, very quickly that most people know very little. But the term insurance brings along a sense of insurance.
Yes.
Okay, because we have car insurance, we have homeowners insurance, fire insurance, flood insurance. All those terms have a contract, and that contract protects you when something goes wrong. So again, most people haven't read their policy for their car insurance and whatever that closely. But on the other hand, they can be assured that if something goes wrong, the insurance company is going to be there and have to deliver on that written contract.
Right.
Health insurance isn't anything like that, but they want us to think it's insurance like all our other plans. Okay. In other words, it is not insurance. Insurance has a legal definition. You have to have a contract, and that contract guarantees you the coverage in the contract. Secondly, you have to own it. You do not own your insurance. Most of the people in the country get it through their employer, and the employer owns it.
Yes.
Okay. The few that buy it directly off the exchange, the insurance company owns it. And the significance of that is if my pickup truck didn't get paid for, I could take him into court, my insurance company into court, and win because I had a right to be there and I had a right to coverage. Health insurance, I don't even have a right to be in court because one, it's not insurance, there's no contract. And secondly, I don't own it. Okay, I don't own my membership. It's no different than the
who is the insurance company's contract with then, if it's not you?
it's owned by the insurance company, or in most cases, it's owned by the employer. I'm sitting in the office of our family business, and we have 50 employees. We give them insurance. We own, my wife and I own the insurance we give them, the plan. Okay. So if our employees wanted to take somebody to court because they didn't get the coverage they think they should, they'd have to take us. Okay. And even then, it's not insurance, so they're not guaranteed. It'd be a losing fight. The point I'm making is when I say that people don't, everything they think they know about insurance, they don't, is wrong. They start from the premise that it's insurance and it's mine. Okay. And if you go to the emergency room or the hospital, wherever you look on the wall, we've all seen the signs. You accept responsibility for whatever your insurance doesn't pay.
Exactly.
They make sure to put in insurance so that we think it's insurance and therefore we think we owe. But the contracts that the insurance company has every in-network provider in the country sign state specifically that the provider must provide all medically necessary care. And if the insurance company chooses not to pay, the patient can't be billed.
So how can your doctor's office, or if you go to a surgical center for some kind of procedure, they all make you sign that proviso that if somehow your insurance doesn't pay, you will pay. How can they make you do that?
Well, it's like anything else. If I ask you to sign a piece of paper and you sign it, there's no criminal law there. That's your problem. If you signed it, every time I've looked across the counter and they've asked me to sign one of these, then I say that's not appropriate. It gets yanked back in a big hurry and they just move on.
Really?
The other point under law, let me make this. You can't sell a bridge twice. They have signed a contract that doesn't allow them to bill you. So whatever you sign is worthless, except you think it's of value. Okay? You think it means something. And where the rubber meets the road is under federal law. If a bill is more than 30 days old and you haven't refuted it in writing properly, it's accurate. and enforceable. And
So
that's not
that
healthcare.
is your 30-day rule, basically, which you told.
Yes.
So
So,
why don't we just start with that from as a separate subject in that sense? So you are talking about basically you are not talking about the percentage that we all pay, like the deductible, or with Medicare,
yes.
you're stuck with 20% and your secondary insurance never pays the whole thing unless you're in an Advantage plan. So you are almost always left with something to pay, but that's something that is understood. This is a situation where you thought you had insurance covering it. It doesn't cover the full amount for whatever reason, so you get billed. Is that correct?
Yes, but your premise is wrong. In
Uh-huh.
other words, you get a little brochure for your plan. Let's say let's talk about my own company. We give them a brochure and it'll say maybe 70% for this or 80% for that coverage, and then you're supposed to pay the rest. That's not what their own contracts say. If you stay in network, the provider that you use is bound contractually to not bill you anything, period. Okay, but you don't know that. So when you are billed, you think you owe it because that sign on the door, that little piece of paper that you sign says you're responsible for what your insurance doesn't pay.
Right.
And if it was any other form of insurance, that's exactly how it works. In other words, when my car or my truck was destroyed, I got a check from the insurance company and I had to put another $10,000 on the line to buy a new truck. Okay, that was understood. And I was perfectly comfortable with it. I got the value of the truck. That's the relationship. What's wrong here is the contract that the insurance company has with the provider, the doctor, the hospital, stipulates that they cannot bill you. Okay. I'm not saying that. That's what their contract says. And it says it about 5 places. And let's make it real simple. That contract allows an insurance company to provide coverage, approve it, provide it, and in a month, depends a little bit whether it's 30 days or 90 days later, but they can come back and revoke it and pull the money back.
Hmm.
Now, what the fine print says in their contract is that when the insurance company does that, they cannot bill you for it, but they don't tell you that either. So I remember an example where a woman was billed $1.3 million because the insurance company pulled it back on a major operation. And they
Wow.
battled in court for something like 3 months, and she was finally able to get it down to $300,000. But she never owed the money in the first place. But I've read the contract. Her attorney obviously hadn't.
Hmm.
So what you have is a situation where you think it's owed because they didn't pay it, okay, and they have the right. 35 years ago, the Supreme Court ruled unanimously that the insurance industry has the right to restrict coverage. So they're doing nothing that they're not entitled to do under law. What's let's say it this way, the core of the fraud is that you think you owe whatever isn't paid. And
And
it's
it isn't the insurance company that bills you, it's the provider that bills you for that money.
That's right. And the provider has agreed in order to insurance in this area, something like the big insurance company pays about 70% of what a hospital would take in revenue.
Right.
Okay. So for the privilege of having that 70% paid for, they're willing to sign a contract that requires them to provide all the medically necessary care you or I require, and then not bill if the insurance company doesn't pay. And I'll quote AMA talking to their doctors. The insurance company will generally pay, but when they don't, you will have to absorb the cost. That's the AMA to their own doctors. But nobody tells you that. And the key of what I'm saying is that this is so toxic to the the insurance to the in-network providers and the insurance industry, they don't want to even risk having the discussion. So let me give you an example. It was just a short time ago. I had a small operation. I was actually in the operating room and they came in with a credit card machine and they wanted $3,000.
Oh my God.
I'm ready for the knife. And I argued, I have 4 policies. What am I doing signing something like this? Anyway, I wasn't going to get the operation unless they gave him the $3,000. So I gave him a credit card. And I came out of the operation and I immediately called my credit card company and I canceled it. Not the card, but the bill, contested it. And then I wrote a letter when I got first chance I got and contested it again. The $3,000 was immediately returned. And they never once tried to defend the bill.
Huh.
Think about that. That's one of the largest, matter of fact, it is the largest hospital in this whole region. And they operate through a very major billing office. And they didn't even once try to justify a $3,000 bill that they had just relinquished, just canceled. It tells you everything. They had no right to bill.
Yeah.
Which is the core of what I'm trying to help people understand. It's not a matter of going out and fighting with them. They can't afford to have the fight because their own contracts say they don't have a right to bill us. Okay? They have to provide medically necessary care. And if the insurance company chooses not to pay for it, that's not our problem. It's the provider's problem.
Okay, so let's stop there. Now that you have watched or listened to this podcast or read your book, you know that you're armed with that information that you didn't have before as a patient. And you get the bill. Where does your 30-day rule come in, and what is it?
The 30-day rule is a thing called the Fair Debt Collection Practices Act. And what it says specifically is that if a bill goes to collection within 30 days, if you haven't refuted the bill in writing, the courts are to view it as accurate. Now, the problem you have is that what does collection mean anymore? Because hospitals are collecting their own money and it gets really muddy. So what you want to do is when you get the bill is just as the Consumer Financial Protection Bureau has advised, write a letter and ask for proof of accuracy, particularly given the fact that they're not supposed to bill you. And what you've done now is you've taken the provider to a place they cannot go. They cannot afford to have the discussion, but under the Fair Debt Collection Practices Act, they have to respond. And if they don't, then the bill can't be enforced. So it's not like you're doing anything to fight. You're just asking a couple simple questions and putting the other side in the position of having to provide proof, which they can't do. And more importantly, they don't want to even try because it risks exposing the whole fraud. Am I making sense?
You're making sense, but okay. So I look at this bill, I write this letter and say I'm not going to pay it because I know that I don't have to. And what happens then? Because most people don't have the guts to do that, and they don't have your knowledge. And we're all kind of afraid of these big companies. Do you need a lawyer? Or can you do it yourself?
What I've done in the book is try to tell you how to make the system work for you. Matter of fact, there's a section in there that says, I don't expect somebody to change the system. I expect you're going to have to live with what's here.
Right.
But the laws are still here for us. We just don't realize how to apply them or know how to apply them. And what I'm saying is, rather than fight with the company, first of all, I'm not going to fight with my doctor. I'm going to pay his bills. They're smaller. They're not the bills I'm worried about. And besides, if I don't have a doctor that I have a good relationship with, I can't access any health care.
Right.
Okay. So I don't want to fight with my doctor.
Right.
I'm going to pay his bills. But I sure am going to question a hospital bill because they're reported to be 80% in error.
Right.
Okay. When I was talking to 2 doctors, very significant doctors in a very large organization, and I brought this subject up, they laughed because they said that best they knew 60% of the of the cost of a hospital bill is generated not by the doctors, but by the billing office. Okay.
And
So,
also, one of the things that Medicare provides very nicely is the retail value of what the provider is trying to charge you, the amount of money that Medicare will allow for it, which is usually a fraction of it, and and what you owe, which is a fraction of that fraction. But it's a good place to look and see what these hospitals, if you don't have some kind of insurance, will try to charge you.
well, we have to split healthcare into two sections: real Medicare and then private insurance. Okay.
Right. Right.
It's trying to define a couple of things. Like, people refer to Obamacare as insurance. Obamacare is nothing more than a requirement to buy insurance, and insurance has to have private insurance has to have a certain structure. But there is no Obama's health insurance.
Right. Right.
It's just a law saying if you're going to buy health insurance, it has to have a certain structure, much like car insurance. You
Right.
got a lot of states you have to have insurance, and it's got to cover the following provisions. Medicare is broken into two pieces: Medicare and then Medicare Advantage.
Or Medicare secondary if you stay with original Medicare. In
Well,
other words, if you take an Advantage plan, um, then they take your Medicare essentially and fold it into this plan with all these little extras like gym membership.
no,
Um,
no, they don't.
well,
What?
they do if you have an Advantage plan. That's why you would have the Advantage plan for the most part.
Well, let's agree to disagree then, because Medicare Advantage is nothing more than the same private insurance I get from my employer,
Right.
except the government pays for it. Okay, which is huge, because under Medicare, the coverage that I'm owed, maybe it's only 80%, but the coverage I'm owed is owned by law. Okay. So I have a right under federal law to receive it, and I know exactly what it is. And matter of fact, if the bill is inaccurate and I'm unfairly treated, the law says I can't be billed.
Right.
It protects me. When I slide over to Medicare Advantage, I'm now in the private system. I have to go in network, and everything we're saying about private health insurance applies to Medicare Advantage. And I'll give you a quick story. I attended a Medicare Advantage presentation, and I sat there, and I was pretty good. I can talk. I enjoy asking questions. Anyway, I sat there for 45 minutes, didn't say anything, and I finally had to say, "Excuse me, I got a couple of questions. One, you keep calling this Medicare, and it's not. It's private insurance that the government buys, and it's the same thing that anybody in here who's working and gets it from an employer would have. The second thing is, you keep talking about the benefits. Under Medicare, they're guaranteed by law. Under Medicare Advantage, you don't guarantee anything. The benefits, you could choose to provide them or not provide them, period. And you have no right, the individual has no right to claim anything else."
Right.
And he said, "Well, you're right, but we have other advantages," which blew me out of the water. Why do you have insurance if you don't have a guarantee of coverage? Okay.
Exactly.
So what you have, the interesting thing is, everything in my book that talks about basically in-network and private insurance applies to in-network, Medicare Advantage, because they're operating under the same single contract. What they have is a contract between the insurance company and the in-network provider. Okay. Now, if you look at say like Blue Cross, the Blue Cross contracts apply to every Blue Cross company across the country. And every one of the Blue Cross companies have more than one plan. Matter of fact, more than one subsidiary. The one here has at least three. And each one of those subsidiaries have 3, 4, 5 plans, some 7. That was the last one they were in here showing us. Well, you can't have a separate contract for every plan, every insurance company, every subsidiary. They don't do it. They have one contract. So if you're looking at Aetna or Blue Cross or whatever, and in a large hospital, there is a single contract between the say Blue Cross, Independence Blue Cross here, and Penn Medicine here, and it applies whether you're talking about Keystone Insurance or Plan X or Plan Z or Gold or Blue or whatever. But they want you to believe that little brochure you get is the definition of coverage, and you believe that, but it's not true. Let's look at it this way. The contract says that they don't have to pay anything, and it's supported by a Supreme Court decision. So last year they gave you 80% coverage for whatever procedure. And this year they want to save a little money, so you're only going to get 70% coverage. Did they change the contract? No, it's the same contract. They're just exercising their right to pay as little as they want to. And the hospital isn't pushing back. They're just accepting it.
All
And
right.
in cases, we pay the bill.
And we could go on about, I think, Medicare Advantage and its relationship to original Medicare and all of that forever, probably. But I don't want to concentrate on that today. I want to concentrate on how you avoid paying these fees that you shouldn't be billed for. So, can we get back to
Sure.
this this charge you get? You get the bill and you write a letter back. And can this be again, I'm thinking of the average person who doesn't write in insurance ease and, doesn't understand a lot of medical terms and will get a bill for something that they didn't think they were going to get and writes back and says, "Can you explain why I'm getting this? Because my impression was that it was all covered," or something to that effect. What happens then? And does it have to be an actual letter or an email if it's accepted rather than a phone call or just something like
Yes.
that?
The law says it has to be in writing. Okay. So if they're counting on you making phone calls and getting into the appeal process and getting caught up in all the gears and the fine points, and you're going to lose that argument. Okay. Because one thing, you're going to run out your 30-day clock and the bill becomes accurate. What what my book, and I'm not trying to sell books. I don't care whether I sell books. I'd like people to understand how they avoid trouble. The book is written simply to allow you to refute a bill without taking any risk. The letters are in the back of the book. They're a little more detailed than they have to be, but I wrote them to make sure that they cover all the bases. But if you look in the back of the book, there are letters to make the system work for you. And the problem you create by writing one of those letters is you fit the law, and they do not want to contest it. So they just drop the bill. And a very good acquaintance of mine is a former head of the billing department for one of the largest hospital in this region. And he looked at my letter and he says, I got one of these. I just dropped the bill. We throw it in the round can and go on. And I've been asked, many people ask me, what happens when you send one of these letters? Nothing. The bill goes away because they can't afford to answer it.
I think you you make it sound very simple and very obvious. Um, but I'm a journalist and I sit here and say, if I just simply take a bill and write back and say, I'm not going to pay it, basically, because I'm not supposed to pay it, I'm afraid to do that. I'm truly afraid to do that because either it's going to turn into a problem or my credit rating's going to be affected or something because I don't know how it works, and even though you say it works a certain way, I'm just afraid as an ordinary person to play games with this big hospital.
You're absolutely right. Okay. That's why you do not want to say, I don't want to pay it or I won't pay it. If you look at the letter I recommend, what I say up front is, I'm very anxious to get this paid. I just need answers to a couple of questions. And per the CFPB, I need to ask about accuracy. Okay. So you don't do anything in that letter, at least the letter that I write for you, that puts you at risk. Your point's a very good one. If you confront them, they can simply wait you out with a 30-day clock, take you to collection,
Right.
and it goes against your credit rating, and they win and you lose. On the other hand, if you ask a question that they have to answer in writing, simple question, according to the Fair Debt Collection Practices Act, they have to answer it. And if they don't answer it, they can't contest or they can't enforce the bill. And they know that clearly. I mean, why would a $3,000 bill get just flat dropped if they thought they could come back and push at me? They can't. And so the whole value of the book is not to fight the insurance industry. They're too big and too powerful. It's to make the system work for you and me individually, where we can say, hey, look, the doctor works for me. Just key point. The doctor is under contract anymore with these provider agreements, but his license makes him mine.
Mm.
And I've never found a doctor yet that didn't appreciate me understanding that, because the doctor wants to serve you. Really does. He doesn't like the system anymore. He or she doesn't like the system any more than we do. But if you understand the system just a little bit, where you know that the doctor really works for you because his license says he does, and they really don't, you don't know what your insurance company doesn't pay. If you could handle just those 2 points, the system changes, because you're no longer being dragged along. You're putting them in a position where they have to respond properly, just as they did 20, 30, 40 years ago when the system was more dependable.
So, okay, we're dealing with one bill for one procedure from one hospital or doctor group. What happens? I mean, the people who declare medical bankruptcies or declare bankruptcies because of their medical bills, they have a ton of them this high. What happens to that person who's just overwhelmed and probably not mentally or physically in any kind of shape to contest anything?
I cover that in the book, and it's not simple stuff, because once you let the bill go more than 30 days, and you're on the backside of the law. But on the other hand, it's a subject that the insurance company just doesn't want to cover. So once you raise the issue of accuracy and appropriateness, I think there's a fairly good chance they're just going to bail out. They're certainly not going to want to settle. Okay? They want to leave. And as far as at this point, there's an agreement that they won't even put a statement on your credit report for 90 days, and it can go out for like 6 months anyway. There's a delay in even reporting one of these if you're not paying it. So there's a good deal more flexibility than there was a year or so ago. But what I am going to say is, you've got two choices. Right now, if you just let the system go and you just roll over and let it take its course, they're going to bankrupt you in a big bill. On the other hand, if you raise the issue of accuracy, they can't answer it. And if you raise the issue that you don't own it, they sure don't want to talk about it. But it's required under the Fair Debt Collection Practices Act. Why not do what I'm suggesting? There's no risk. What you're asking is a question. And that's the power. The real power of it is not because you're saying, you can't do this to me. It's saying, please provide this because I've been told to ask the question.
Okay. Now you are talking to someone who never uses the mails if I can help it, because half the time things don't get delivered, they get lost, whatever it might be. we have a mailing system, a postal system in this country that doesn't work anymore. And you cannot be absolutely sure when you put a letter in the post box or you take it even to the post office that it's going to get where it's going and get there in a reasonable amount of time. So I think what I'm asking is, how do I know that somebody got that letter? Do they write back immediately?
You're taking it at least in my judgment, to a level we don't have to go. In other words, they're going to send you a bill through the mail.
Right.
Okay. I can respond in the mail to the same address. And as long as I keep a copy of that, and if I get taken into court, I can hold up the letter and say, whoa, 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 whoa. Okay. So you're fine. I mean, you could send it by registered mail and so forth. I just wouldn't make it that complicated. The important point is to send the letter. And then if you get a second bill, send the letter back again. I did not get an answer. Okay. So they're depending on the mail coming one way. Why can't we depend on it going the other way? And I understand your issue of the mail. Believe me, I'm in business. There are issues, but it gets there. It may be 7 days instead of a reasonable 3. But if the mail's coming one way, it's going to go the other way. And the point is to do it and keep a copy. That's all you have to do. And if you get dragged into court, you go, wait a minute, Your Honor, and you have a case.
Let me ask you one other question, which is basically, we don't know right now the fate of some of these rules or laws that have been put into effect about or anything. Because of the effort to downsize the government by the Trump administration. The Consumer Financial Protection Bureau has basically been shuttered as we speak, and some of what they do has gone into Treasury, and some of it just isn't being done anymore. You're citing a law that is separate from that, correct? And has been around way before this bureau was put into being. And what you're talking about is not likely to be affected, or is it likely to be affected by something that happens in dismantling this consumer protection agency?
Well, first of all, dismantling the agency is one thing. Changing the law is something else. Okay. The Trump administration is not going to go back and try to wipe out the law, because the only way to do that is go back through Congress. You got the whole process. What they're getting rid of is people.
Mm-hmm.
But what I would say to anybody is, if you depend upon the Consumer Financial Protection Bureau or the state Department of Insurance to argue for you, to provide help and defense, I got a bridge to sell you. Okay. It isn't going to happen. They don't even understand what they've done. And I put that in the book. In other words, the Consumer Financial Protection Bureau has said, well, we got to check accuracy and so forth and so on. They don't realize the reach of what they've done. And I don't think they would ever acknowledge that they basically invalidated the healthcare bills across the country.
Mm.
Okay. So I'm not counting on them to do anything. They've just asked me to ask a question. And that's what courts are about. The burden of proof is now on the other side if I ask the question. And I'm going to ask you a question. Do you think anybody in the Trump administration is going to want to come argue that people don't have a right to understand the accuracy of their health care bill?
Well, I would hope not, but a lot of
No.
stuff is being done very quickly, and you know, we literally don't know some of the outcomes. This is
Let me help here a minute, because I think it's an important point you raise. Every bill that you ever get, you have a right in court to ask for proof of accuracy, except healthcare. And up until what the Consumer Protection Bureau did, the courts ignored it. In other words, for healthcare. Now the door's been opened, genie's out of the bottle, and all you're doing is asking for what you'd ask for any other bill. I'm in the hardware and supply business. We send bills out every year or every month. people have a right to understand what we're billing them. Okay?
Yes.
That's all we're saying here. The difference is what you typically do is if you have a bill that's a problem, you get on the phone and you argue with your insurance company. That's a lose-lose argument. You're not going to win that one. What I'm saying is send a letter to whoever sent you the bill, ask them a couple of simple questions, and put the burden of proof on their side of the ledger. More than likely, they're going to bail because it's a question they do not want to answer. And I'm not guessing at it. I mean, I've talked to, I'm a good friend, head of the billing agency for the largest hospital in the country in this region, and he agrees with me. It's just something they do not want to get into. And the reason it works so well is how many people you think send a letter like I'm suggesting?
I
No,
would say none of them, like, because they don't know they can.
they
Certainly
don't know
I
they
do.
can. So if you do, it's easier to drop the bill. And my good friend, the attorney that I took to help me with the book, he refers to it as it's cheaper to eat it. In other words, it's cheaper to eat the bill than it is to go out and answer the questions because they don't want to get near those questions with a 10-foot pole.
Right, right. All right. I think then that we will take your word for it and leave the discussion there. Is there anything you would want to add to what you've already said in terms of how you deal with this billing?
No, I think that'll pretty much answer it, except I would ask people to go to killabill.com, Kill, capital A, Bill, BILL.com. It leads to the book, but I am not here to sell books. I'm here to help people because there are so many people. More than 50% of the bankruptcies in the country are for a health care bill. And families are getting killed, and it only will get worse. So hopefully you'll take a look at killabill.com. That'll take you to the book and read it and make the system work for you rather than having you basically taken over the coals by the system as it gets steadily worse.
All right, Frank, thank you very much for coming on the podcast. This is really, really interesting. And let's hope it radiates out and does some
I
good.
thank you. I enjoyed it. Real pleasure. You have a great day.
Interesting, right? And there's a link to Frank Lobb's latest book, The Big Lie in My Healthcare Bill, in the show notes. Now, I'm pretty sure you know about the opioid crisis in the U.S. and in many other countries. Most experts trace that crisis to 1996, when OxyContin was first pushed to doctors and marketed to their patients with chronic pain. The deadliest period, though, has been since 2020, when illegal fentanyl hit the streets. Drug overdoses claim over 100,000 lives annually in the United States, and it's the highest rate in the world, according to the Commonwealth Fund. In my next podcast, episode 32, my guest will be Dr. Aaron Gupta. He's a Michigan doctor who got so upset about the plight of addicted patients in his mostly rural practice that he became a specialized addiction doctor. Then he wrote a book laying out the history of opioids and what needs to be done to help patients recover. Now, this is a conversation I don't think you want to miss. Look for episode 32 to drop on the third Tuesday of April, since, as you know, I schedule one new podcast a month. I'd really appreciate it if you'd subscribe and share. We're on Apple, YouTube Music, Spotify, TuneIn, Amazon Music, iHeart, Podchaser, and my host platform, the Podbeam app. The video version's on YouTube, show notes and links on my website, www.stephanieshelton.com/conversations. I'm Stephanie Shelton. Take care of yourself and all those you love, and I'll see you soon. Conversations on Health, How We Get There is produced and edited by Frank Harold. Research assistance from Dr. Richard Saltman, Professor Emeritus of Health Policy and Management, Rollins School of Public Health at Emory University in Atlanta.